everyone, I'm Dr. Lakshmi endocrinologist at Magna Centers, Mysore. So nowadays, a lot of patients come and ask me about reversal in diabetes. Diabetes once-sati bandre adana reverse madakagutta anta. So first of all, reverse is a wrong term to use. Now adana remission anta helti. So diabetes remission, is it possible? It is definitely possible. But nowadays, I see a lot of patients, going through online materials, and everybody on the net is offering a diabetes reversal package, and I see many people getting deceived by such packages. So while you have to know that diabetes remission is definitely possible, it is possible in a subgroup of patients. So not all patients with diabetes are eligible for diabetes remission. So if you are diagnosed with diabetes, say less than 6 years ago, or if you are on the overweight side, and you are on less than 3 to 4 medications per day, then it makes you a likely candidate for remission, and it takes a lot of expertise to pick the right kind of patients who are eligible for remission. So we have a lot, we in fact have a lot of patients who have undergone remission, but it is very important to pick the right patients who are eligible to undergo remission. Otherwise, it may be a failure. So what exactly is remission? If you are not on medications, but you have controlled your diabetes with lifestyle changes alone, it could be diet and exercise, then that means you have achieved diabetes remission, and it is very much possible. But it's very important to remember that when you look for these packages on the net, or if somebody is offering you a diabetes remission package, you have to look at the credentials of the person. It is very important to see that if you are trying for diabetes remission, it is done by a qualified healthcare professional. You have to see their qualifications, and whether they are qualified to do it, and whether they are doing it in the scientific way. Now I see many patients join some sort of programs for 3 to 6 months, or maybe 1 year, and they are asked to eat very less. So probably they eat very less, or they eat only fruits and vegetables, or they skip 2 meals a day, they have only 1 meal a day, and go just on liquids and stuff like that. So while these are good in the short term, these are not sustainable in the long term. ಯಾರಿಗೂ ಇದನ್ನ ಒಂದು ವರ್ಷದ ಮೇಲೆ ಮಾಡಕ್ಕಾಗಲ್ಲ. So if you're doing extreme measures, you're going on extreme diets, you're going on extreme exercise regimens, that is okay to do for 3 to 6 months, but nobody can do it over the long run. So when you start any diet today, aiming at diabetes remission, or aiming at a good diabetes control, you have to ask yourself one question: whether you'll be able to do it for the rest of your life. So if you are able to do it for the rest of your life, then it is good to start. But if you think that you're able to do it only for 3 months and then you're going to stop, then it's not going to help you, because many of you might have already noticed that the minute you stop doing something, all the weight that you have regained, or all the efforts just go in vain, and the weight comes back, or your diabetes control becomes bad again. So whatever you do, just ask yourself one question: whether you're able to do it for the rest of your life. And if you are enrolling yourself in any package that says that they are going to cure your diabetes, or give you diabetes remission, you have to look at the ways by which it is being achieved. If it involves extreme measures like not eating at all, or asking you to go hungry for hours, or skipping meals, or some crazy regimens for exercises, then it's not worth doing, because in the short run you might achieve good results, but in the long run it is not good at all.